Hi everyone, my name is Stacey, and today I'm going to be talking to you about rheumatoid arthritis and the effects it has on an individual's physical function and the contribution it may play to their functional status. I'm just going to start you off with a bit of background information. Rheumatoid arthritis is an autoimmune disease that causes pain and inflammation in joints. And as you can see from the diagram here, it is one of the top 3 forms of arthritis affecting individuals today. Although there is said to be more than 100 forms of arthritis affecting the musculoskeletal system. Just a few statistics for you. The table here is presented from the Australian Institute of Health and Welfare. The table shows the prevalence of self-reported rheumatoid arthritis by age and sex from 2011 to 2012. 2% of Australians have reported having rheumatoid arthritis in 2011 to 2012. That's approximately 445,000 Australians. 5 out of the 8 people which have reported rheumatoid arthritis have been women. That's 2.4% of women compared to 1.5% of men. 10% of people with rheumatoid arthritis have reported poor health compared to 3.1% of people without rheumatoid arthritis. There's been a 54% raise in hospitalisation for people with rheumatoid arthritis from 2004 to 2013. The onset of rheumatoid arthritis occurs in those aged between 35 and 64 years, most commonly in those over 65 and women. Women are at a high prevalence of 1.6 times higher than men of developing rheumatoid arthritis. Women often tend to also develop it at a younger age. As mentioned earlier, rheumatoid arthritis is an autoimmune disease that causes pain and discomfort within joints. In autoimmune diseases, your immune system starts to attack its own healthy tissue, in this regard, the synovial membrane of joints. The joints most commonly affected by this are those of the wrist, elbows, hands, hips, knees, ankles, and feet. And this is not to leave out that organs can also be affected. Organs such as the eyes, skin, heart, lungs, kidney, nervous system, and the digestive tract. Now that you've had a brief introduction into rheumatoid arthritis, this will hopefully lead into the objectives of this PowerPoint presentation. That is to describe the effects of rheumatoid arthritis on physical function, to outline a few limitations and/or disabilities associated with rheumatoid arthritis, and also to discuss the contribution of various factors affecting functional status. Here we show 2 images, to the left that of a healthy joint and to the right that of a rheumatoid affected joint. As you can see, muscle wastage is starting to appear. We have a destruction of the bone, an inflammation of the synovial membrane, and a migration of extra tissue buildup around the joint. You can see how this could potentially impact on physical function and activities of daily living. In 1949, the New York Rheumatism Association published recommendations for a definition of rheumatoid arthritis, a classification of progression, responsiveness, activity and functional impairment. This in which was accepted as the American Rheumatoid Association's classification of functional capacity in rheumatoid arthritis, as you can see on the table on the screen. This table was used as a quick and simple method and has been widely used and accepted over the past 40 years. New approaches, such as self-reported questionnaires, have been used to measure not only function but other aspects of health, such as psychological and social well-being. This classification table has been broken down into 4 groups. Class 1, complete functional capacity with ability to carry on all useful duties without handicaps. Class 2, functional capacity, adequate to conduct normal activities despite handicap of discomfort or limited mobility of one or more joints. Class 3, functional capacity adequate to perform only few or none of the duties of the usual occupation or of self-care. And finally, Class 4, largely or wholly incapacitated with patient bedridden or confined to wheelchair, permitting little or no self-care. In 1988, the Therapeutic Committee and the College of Rheumatology decided to review and revise the original classification system. Here we have the revised classification criteria of the American College of Rheumatology. We still have the 4 classes, but slight variations. Class 1, completely able to perform usual activities of daily living, self-care, vocational and avocational. Class 2, able to perform usual self-care and vocational activities, but limited in avocational activities. Class 3, able to perform usual self-care activities, but limited in vocational and avocational activities. And Class 4, finally, limited in the ability to perform usual self-care, vocational and avocational activities. The revised criteria offers new light on a slightly outdated model. As the earlier criteria offers a benchmark for disease definition, its limitations discriminate between established patients from those with rheumatological diagnosis. Therefore, not helpful for early detection. The new criteria results in a more uniform distribution of rheumatoid arthritic patients from complete function to severe limitation. Here we have a list of some of the physical symptoms that will affect and subsequently hinder the individual's ability to perform activities of daily living. This will therefore influence their ability to perform more complex activities and movements. Some of these include, specifically into the joint, destruction of cartilage, cumulative inflammation, stiffness, swelling, pain and sensitivity, a redness and warmth, reduced range of motion, and of course a joint deformity. Not just only in the joints, symptoms can affect the body. Symptoms such as fatigue, sickness, decreased appetite, weight loss from decreased appetite, muscle aches, rheumatoid nodules, inflammation of the lungs, chest pain, and lastly, a hoarseness in the voice box. Not only do you have to consider the physical limitations associated with rheumatoid arthritis, but that of the functional limitations as well. Things such as reduced range of motion, a person's physical fatigue levels, their cardiovascular fitness, and of course reduced or limited strength ability. With this decrease in range of motion, this may limit or exclude certain exercises or activities. In combination with the lack of range, a rheumatoid arthritis individual has reduced strength performance, as strong muscles are important to provide support and protection of joints. However, these exercises usually have to be modified. Due to fatigue being both physically and mentally draining, cardiovascular fitness is highly encouraged, as it is said to improve stimulus, decrease fatigue levels, decrease pain, and even help in depression. As everyone knows, exercise releases endorphins. Just wanted to show a few images of the effects rheumatoid arthritis has on our joints. You're more likely to see common images of hands and feet with these symptoms. To the left there, we also show some of the major organs affected by rheumatoid arthritis. You can clearly see how debilitating this may be to someone. Now moving on to functional status. According to the American Thoracic Society, functional status is an individual's ability to perform normal daily activities required to meet basic needs, fulfill usual roles, and maintain health and well-being. Functional status can be broken down into 2 categories: functional capacity versus functional performance. When it comes to functional capacity, this represents an individual's maximal capacity to perform a daily activity, both physically, psychologically, socially, and spiritually. For example, a maximal exercise test. When it comes to functional performance, this represents activities people do during daily life. For example, self-reporting. Several factors can affect functional status. For instance, biological impairment, physiological impairment, symptoms, an individual's mood, and their own health perceptions. For example, a person who we may view as well, but they view themselves as ill, may have a low level of functional performance in relation to his capacity. Many studies have been done over the years to try and understand the effects of rheumatoid arthritis on an individual's functional status. As we all know, this can be broken down into functional capacity and functional performance of an individual. In 2001, Welsing found that functional capacity decreases over the time course of the disease, as well as joint destruction, and that the amount of destruction was comparable to the amount of the affected area. In 2009, the Australian Institute of Health and Welfare found that activity limitations imposed by rheumatoid arthritis can alter an individual's perception of health considerably. Disruption to family life, reduced earning, and restricted social interactions are more pervasive, while potentially being more devastating than joint pain and limitations itself. They also found in 2010 that although many comment that the condition does not interfere with their day-to-day life, data confirms otherwise, and that self-perceptions showed no major difference between people with rheumatoid arthritis to those without rheumatoid arthritis. Here are a few practical applications that we need to consider as exercise physiologists, considering the notes we have just learned about rheumatoid arthritis. The use of the classification criteria to design and implement appropriate training variables. The classification criteria will be a useful tool when placing an individual client into a potential setting. This shall allow for a justification of the exercises, which can be used or not used depending on a person's physical function. Just as a side note, the criteria will always be changing, so this should be used in conjunction with other assessments and standardized materials when designing an appropriate program. Using the functional limitations associated with rheumatoid arthritis, such as reduced range of motion, fatigue, decreased cardiovascular fitness, and reduced strength as a building block. We should take from this PowerPoint an enlightened approach to training variables to focus on, by seeing the functional limitations as a building block to where our training exercise should be targeting, rather than a restriction on what we can't do. Improving these areas, if only slightly, would make a huge change to the life of a person with rheumatoid arthritis. Incorporating the concepts of functional status, not only in everyday life, but into everything we do. The use of a functional status assessment is a fundamental tool in identifying an individual's own view of their health. The purpose of this assessment would be to indicate severity of the disease, measure a person's need for care, monitor change over time, and whilst maintaining a cost-effective clinical operation. The assessment would make light of areas which may need more attention. We are now at the end of my PowerPoint presentation, and just to finish up, I'd like to summarise with some of the main concepts associated with rheumatoid arthritis. Rheumatoid arthritis is the second most common form of arthritis, although there is said to be over 100 other forms affecting the musculoskeletal system. And as we know, the joints such as the hips, knees, hands and feet tend to be most affected. About 445,000 Australians suffer from rheumatoid arthritis, in which those aged between 35 and 64 years are more at risk, and where women have a higher prevalence than males. That's about 2% of the entire population. Rheumatoid arthritis is an autoimmune disease. This basically means where the body attacks itself, which most commonly affects the synovial membrane, causing pain and discomfort. In the 1940s, a classification criteria table was established and then updated in the 1990s to provide a simple method of identifying severity of rheumatoid arthritis. Symptoms can affect physical functioning in joints and organs. This will limit an individual's range of motion, strength, and cardiovascular endurance. Rheumatoid arthritis not only affects physical function, but also factors affecting individuals' functional status, in which we have learned that functional status is an individual's ability to perform normal daily activities required to meet basic needs, fulfill usual roles, and maintain health and well-being. I'd like to thank you all for listening to my presentation and hope that you have learned something new.